London, which is opposite Euston Station. And there's Mark Sawatzka, Jeremy Corbyn, Tiana Andreo, Pete Murray, Diego Gillett and Don Gibson. I don't know who they are, some of those, but I'm sure there are people here who do. So that's there. If you see Matt here, he's got leaflets. The other one is, it's on the same day, but here in Birmingham on the evening, and oh sorry, I'm telling a lie, it's on the 22nd of April. So, sorry, I'm cracking up. It's Naeem is organising it, stand up Naeem, in case people want to see you at the end later. It's called Human Rights for All, and it's a hustings with various candidates at it, so there are leaflets for that on the side if anyone is interested in that. The next speaker I'm going to call is John Lister, who is from the London Health Emergency, and he's obviously speaking about the cuts in the health service. Thanks, John.
Thanks, and thanks for the invitation. Well, good turnout, and obviously there is a rising level of concern about what's taking place in our public services generally, and I think in particular around the NHS. I've been campaigning 26 years for London Health Emergency, and we don't know those called London Health Emergency. We've covered the bulk of England, and I've spoken at meetings up and down the country, and I think that we've been through a whole period in which most of the argument has been about privatisation. Most of the argument has been about the way in which the Labour government has been spending, or the new Labour government has been spending the money that they put into the National Health Service since 2001. And now we're in a phase where all that's suddenly turned around, and we're back to the same type of discussions we were having in the 1980s. It brings back exactly some of the points there. London Health Emergency was set up in 1983 by the GLC to bring together campaigns against hospital closures right across the capital and to actually centralise that fight, which turned out to be completely impossible because they all had their local campaigns. But what we were able to do was develop an information base which has continued. We work with trade unions, we work with local campaigns up and down the country. And now we're in a new situation where the NHS is facing an estimated £20 billion worth of cuts over the next 5 years. 20 billion. I mean, that's a lot off the NHS budget of 105 billion. Okay? So even when you're talking really, really large sums of money, this is still, you know, these are the biggest cuts the NHS will ever have experienced in 62 years since it was formed in 1948. Far, far bigger than what we were fighting in the 1980s. Proportionally. And we're looking at a really drastic situation. In London, the Strategic Health Authority there has said there's going to be £5 billion is going to be cut from London's healthcare. They've already drawn up plans, I've just been working through it today, drawn up actual plans at local level for £3.4 billion worth of those cuts to take shape. They're talking about closing a third of the hospital beds in London. That's up to 8,000 hospital beds in London. Okay? They're talking definitely, we've already got plans to close 3 hospitals, and it looks like more are going to go in London because 8,000 beds is, you know, a dozen or more general hospitals to close. In fact, on the NHS London map that they've put at the front of their most recent plan, 23 of the 40 hospitals in London are coloured green, which doesn't mean go, it means that they're under consideration and their future's being reviewed. So there's a majority of London's hospitals are uncertain about what the future has, what services they're going to have left. And I'm not just talking about London, but London has the most advanced and detailed plans, which is why I'm just mentioning them, because it gives you an idea what's going to be coming, because in the West Midlands here, they're talking about £2.4 billion worth of cuts. Just up the road in Manchester, they're talking about £1 billion of cuts in Greater Manchester. So this isn't just a London problem, this isn't just me going on about London, this is me warning that what they're rolling out in London and the type of arguments they're using in London are going to be used elsewhere as well. We've got, for example, arguments that, of course, again, as with all these local government things, these aren't cuts, they're efficiency savings, okay? And in fact, everybody's going to work differently and there's going to be innovative new methods and so on. And one of the innovations is apparently they're going to replace your accident and emergency units, that you know where they are, and they're in a logical place, they're where all the other services are, everybody knows where they are, they're open 24 hours a day, there's a raft of staff there, a variety of different skills. If they've got something more serious wrong with you, they can treat it. If you've got something less serious wrong with you, then you can still get seen within 4 hours in an A&E. They're going to replace that with, in London, a network of what are called polyclinics. And I know that they're moving in a similar direction in other parts of the country, except they're now calling them GP-led health centres or poly systems or whatever, okay? Which has nothing to do with parrots, okay? The parrots don't get a look in. This is revamping and forcing, and I do know in Birmingham they've been looking at forcing GPs into bigger and bigger joint practices in these big health centres in order to deliver services. And part of that is to create the basis on which they can, again, as I say, switch this workload away from hospitals and into these polyclinics. They believe it's going to save a lot of money. But we don't know whether it's going to save any money or not, because nobody's actually done any proper costings of what the polyclinic costs to run, what the scale of a proper full-size one would be, that would take the kind of caseload they're talking about coming from hospitals and from primary care services. In London, Lord Darcy drew up a plan for 150 polyclinics across the capital, right? And each one, according to Lord Darcy, was going to handle around 300,000 patients a year, both from GP appointments, which is about 200,000, plus outpatients being diverted from hospital, plus minor accident and emergency units, plus psychiatric medicine and mental health services, plus various diagnostic tests were going to happen there, x-rays and God knows what, plus if you weren't really careful you'd wind up getting your minor surgery there as well by a doctor who fancied a dabble and occasionally did a bit of minor surgery. You know, this was absolutely, you start to think about the scale that this would have to be to handle this kind of caseload, the complexity of trying to organise a small-scale hospital, except it's called primary care, it's called something different, and in fact, in all the costings that Lord Darcy put together, there was hardly any management or administration to actually make it work. You just imagine, you go to your health centre, you go to your GP, it doesn't work without the staff behind the desk, does it? I mean, there might be dragons and hard to get onto, but in some cases, some of them are marvellous. But on the, you know, the fact is, they make it work. The doctors themselves very seldom actually organise the health centres. And certainly when you're talking about the scale that Darcy was talking about, with 24 GPs at a time, lashed together into these, 24 GPs is a riot, and by my reckoning, I mean, you get 3 of them working together is a triumph. You get 24 of them working together is beyond human ingenuity, I think. So we've got that kind of problem, okay? So there's this plan that's supposed to solve all kinds of problems by diverting patients from hospitals into these new units, many of which they don't even know where they're going to be, they don't know how big they're going to be, they've never run anything like that before, and they're saying, oh, this is the only way in which we can deliver the efficiencies that we need in the NHS. And this is the basis on which all our plans are going to go forward. Now, I just mention it to you because you've obviously thought this already. If you're taking the most minor cases out of accident and emergency, and they're talking about taking 55% of them, no, 60% of them out of accident and emergency. You're taking 2/3 of the patients out of accident and emergency. You're taking half the patients out of outpatients. You might have a very big problem about how to organise those services. What you're not doing is opening the possibility of closing 1/3 of the hospital beds, because none of those people use beds anyway. Right? So you've got a whole series of ideas, none of which actually seem to join up. But it's all assumed to join up. And you've got all these managers, and mainly advised by management consultancies who are making a fortune out of this, okay, because you've got droves of them. In every available primary care trust office is stuffed with these characters with their suits and their £1,000 a day plus expenses, and they're sitting there with their calculators rolling out things. And all of these arguments, and I won't bore you with the details, but none of these arguments are backed up by any actual evidence. You hear them talk all the time about the fact that doctors, before they implement a new treatment or work in a certain way, they need to follow evidence, okay? but appears policymakers don't have to take any notice of evidence whatsoever. They can just make it up as they go along, and it looks like McKinsey's, you know, the American management consultants who are over here, overpaid, overrated over here, right? All over the NHS like a cheap suit,